Okay, well, I guess we're going to get started. So it's a real pleasure to have everybody here. And I will give just a little background. It's kind of boring, I guess, but I'm an optometrist. I graduated in 1975. Optometrists are medical eye doctors, not medical eye doctors, but they're doctors that are, we have to go through 4 years of undergraduate school as well as 4 years of graduate school. And then we get training through different clinics that we visit during our course of school. And then we're let out in the real world to try to figure out how to provide a service, a significant service to people, actually. Now it looks like the majority of people have been to an eye doctor, and so we need our vision. And I think as we talk today, because I want everybody to sort of talk, and I want to have a back and forth communication. Our vision is very significant and very important for what we do. And so we're going to really focus on school and learning and development and how we do things and how our vision system supports what we do, and particularly in school reading. So we're going to have hopefully some fun, and we're going to be interactive, as I mentioned. And we're also going to I'm going to do a lot of demonstrations, because that helps people to get a better feel and hopefully take back with you information that you can grow with and maybe communicate to other people. I'll touch on things that you people might personally have experienced, or that you know people that might have problems that manifest certain behaviors. Now, and the information, the email, I guess, that was sent out to people that are involved in this group looks at different things that kids particularly do that can be related to vision problems, which I think will sort of give everybody sort of insights on how vision is important, why is it important, and how it can affect certain directions and how it really affects our thinking, basically. So, I'm, like I mentioned, an optometrist that went on a journey about 17 years ago. I saw kids in my office, smart kids, 20/20 vision, but they were struggling in school. They couldn't, particularly for reading, they didn't have the skill, or they haven't developed the skill to read, and the kids were very verbal. The kids were, as I mentioned, were able to communicate. They were tuned in, but they were not successful in school, which is sort of a roadblock to their whole life, basically. And so I saw a number of these kids. I read some articles I was actually the executive director of the state organization. And I got all these journals from different subspecialty optometry groups. And this one magazine I was paging through, and there was a little girl working with eye doctor, and they were just doing a vision therapy type of activity that we do all the time now. But it just struck me that there was something else besides what I could do at the time to help people. And so I literally, I maybe shouldn't say this, because there was a church next to my office that I had to let go, basically. And I expanded my office to provide a service called vision therapy, and we'll talk about this a little bit later. But before I did that, I had to get some understanding of what this is all about, how vision affects a lot of different things. And that's why it's maybe not widely embraced or understood, because we have to look at how our body system is set up. And that's with how we develop as an infant, toddler, preschooler, and what we do in school. So we have to sort of look at development and look at how significant our vision system is with a new infant figuring out this new world that they are born into. Then also we have to look at how we learn with the educational system and how information is presented. Vision has to be the dominant sense, and I think you'll realize that as I continue to talk here a little bit. We have to look at how our vision is connected with our brain, which is significant. And as I was talking to Carrie here, that our brains are pretty sensitive to injury, and it can disrupt all our body systems, including our vision. And because our vision system is very pervasive in our brain, an injury can be very detrimental, as I talked to some people here previously. So vision is really a part of our life, and when you think about it, we don't do anything without our vision system supporting us, except maybe sleeping. Actually, sometimes we get some images and dreams and things, and that's still connected with some experiences that we might have had, when we were awake. But our vision really supports everything that we do. And in school, it's absolutely needs to be the dominant sense. And as I mentioned, I think you'll come to realize some of the different aspects of the vision system as we continue on with this little talk here today. So I'm gonna have, let's see, there's 8 people here, and so I'm gonna have people pair up in just a little bit, because I'm gonna do some demonstrations that you can actually see some of the things that our vision system has to do when we are engaged in close-up viewing. Of course, and let's talk about school sort of in general just for a second. What does the student have to do when they go to school? And
They have to be able to read.
they have to be able to read. Okay, first of all, they have to
Be able to see.
They have to be able to see. Okay, so they're going to be sitting in a chair or a desk, and they have to listen, of course, to what the teacher is saying, but also they have to attend to information that's presented visually, and most information is presented visually in school, actually. And so, so they have to look and be able to see clearly information. They have to be comfortable for near vision. And so a lot of the talk that I'll be giving today is regarding near vision and how our vision system has to make a change for sustained near viewing when it comes to reading, doing paperwork, doing computer work, and being able to be understand and remember information that we're looking at, basically. So it's really amazing that our vision system isn't talked about very much. It's such a critical part of how we live and interact, but it's not talked about. We talk, and some of the common things, we go to an eye doctor. Have you been to an eye doctor?
Yes.
Okay. So, do you have 20/20 vision? Okay. Okay. Well, do you have glasses?
It's a long story.
Okay. Well,
No.
Okay. Well, let's.
Been there.
Well, one of the goals for an eye doctor is to help a person be able to see clearly, and the 20/20 fraction is sort of a big support, or actually a big goal, I guess, that an eye doctor tries to move a person toward. So 20/20 vision is sort of the standard. So what does that mean? What is your understanding of 20/20 vision?
I see at 20 feet what I ought to see at 20 feet.
That actually is pretty good. As that's not too bad. Anybody else want to add to that? So 20 feet is the distance, exactly right. And actually, I just happen to have an eye chart with me. So, and this chart actually is 20 feet away. And that's the top number of the 20/20 is the distance where this chart is away from the
Which
person.
line?
Actually, it's the line above the red line.
Okay.
And the bottom 20 is the size of lettering that a person should be able to see if they have 20/20 vision. So it's a measure of how small you can see far away, basically.
Okay.
So, that's it. That's it. What does it say about how we pay attention with our vision? How comfortable we are when we're doing schoolwork? How quickly we can move our eyes when we're reading? How we remember what we see? How we integrate it with listening? And how we use it when we move? And how it helps our body sort of position where we are and gives us information basically on stability with just having a bilateral system basically. So it doesn't say anything about any of those things basically. So, and those are very important. So, as I mentioned earlier, reading is the key for success in school. So, what is involved with reading? So, I'm going to have people pair up, and I'm going to have everybody read a short paragraph to themselves. And then I'm going to, because I want to have them watch what a person's eyes are doing when they're reading. So, let's see, there's, let me just give you one for, now, excuse me, actually I need to, on my nose actually, so I need to get a tissue, here we go. Sorry. Okay, so might be going to bullet by bullet possibly, but I want you to hold this up so the person can look, so one person reads, the other person looks at the eyes and what they're doing. And so you have to sort of hold it up and hold your eyes open, and just read to yourself this short paragraph on the top. And then once one person reads and the other person will look, and then vice versa. So I'll give this to you here, and you can pair up with your mother there. And then
The moment of truth.
maybe you can come over here and do it with this lady here.
Okay.
We're going to read this out loud. or
No, just to yourself. Just to yourself.
Wait a minute.